I get asked this a lot as a physical therapist, seeing a lot of post-surgery patients. What am I allowed to do at home in the first week? The answer to that is, for the most part, you can do whatever activities you can tolerate as long as you're not breaking any precautions, or you're not putting yourself at risk for infection, or you're not putting yourself at risk to fall or re-injure that surgical area. So an example of this would be, after a knee replacement, are you allowed to ride a stationary bike? The short answer to that is yes. You are allowed to ride a stationary bike if you have the appropriate range of motion. If not, you might need to start with just rocking back and forth within the wheel wells. And that's totally fine. That's a great way to get your knee moving, but stay in a tolerable pain range. If you found that helpful, please follow this channel for more post-surgery PT content.